So good afternoon, Christina Braga from Assured Partners EMD.
Wendy Wheelock from Assured Partners as well.
And we are going to go through your open enrollment presentation. So we're going to clarify the plan that you have. We're going to talk about some education. We're going to talk about dental and vision. We're going to wrap up with your new process for open enrollment this year. We will try to be as entertaining as humanly possible. We wanted to include medical terms. I'm not going to go through these, but if you do want to review the presentation, they're in here. So if there's any language you want clarification on, you've got a little dictionary here. Plan options we're going to talk about. You're still going to be with MVP this July. You're still going to be with Guardian, Dental, and Vision. So for the 2024-25 medical plan year, MVP provided Norwich with a lovely 31% increase, and that actually was negotiated down, believe it or not. So we wanted to go through a little bit about how your renewals arrived at. So Norwich is what's considered an experience-rated plan. So how we're using the plan determines the rates that we get the next year. So there's a couple things in particular that were driving increases for the new year. So it's based on a look-back period. So we did have some high-cost claim activity, some increased musculoskeletal conditions, more expensive prescriptions being used, and site of care is another thing that we're going to talk about, so where people were accessing care. We're also going to go over, well, how can we change this trend, right? There are very easy things we can do to try to reverse this trend or slow this trend, right? Inflation we can't do much about, but there are plenty of things we can do something about. So we'll talk about understanding options for care to make informed decisions, downloading or registering for GIA, which is a great service Wendy's going to talk about, also shopping for medical services, visiting your primary care provider for your annual wellness exams and screenings, choosing generic prescriptions whenever possible, and utilizing mail order for maintenance scripts. All those things we're going to cover in greater detail. Okay, jumping in. Your medical plan with MVP, still the same PPO, HDHP stands for high deductible health plan. So even though it is a high deductible health plan, we know that the district funds that in-network deductible. But behind the scenes, the plan is a $5,000 deductible for a single and a $10,000 deductible for a family. If you should meet the deductible, other services become either a copay or co-insurance. So you'll see under primary care visit an asterisk and $35. Asterisk means deductible first. Then if you do meet deductible, it becomes that corresponding copay. And you'd pay those copays potentially all the way up to your out-of-pocket maximum, which is $6,450 a single, $12,900 a family. And I say you pay, but we know the district has that account with the funding available. GIA virtual care visits, you're going to notice, are $0. There's a ton of services you can get for $0 that you've had access to, and you might not know about all the services. If you're a person who's in the health savings account, you have to look at it as a bank account. So if I'm looking at my bank account, do I want to spend $110 for a sick visit or nothing for the same sick visit that I can do virtually? Well, I'm a bargain shopper, so I'm going to pick the $0 option. We're going to talk about those types of things today. Wellness benefit is another underutilized benefit that you have access to. We've got flyers up here, but there's a ton of services you're probably already getting or you could be getting to benefit your health, and you can get reimbursed up to $600. So there's tracking devices, camping equipment, fitness memberships, social, there's after school programs, theater tickets, museum, music lessons. There's mind and spirit, stress reduction classes, mindfulness programs. There's a whole bunch of things you can do. So we encourage you to check it out to get reimbursed the money that's already sitting there. Prescriptions. All of them are going to be subject to your deductible, so you're going to pay the full cost or the negotiated rate. If you should meet your deductible, then these copays will apply. The $10 for generic, $30 for preferred, and $50 for non-preferred. Okay? You do have the mail order available. Again, you'd pay the negotiated cost for the 90-day supply up until your deductible, and then it would become those corresponding copays. I'm a visual person, so I like to put words into graphs because sometimes I think they're easier to understand. So on the left-hand side is an example of a single person who's on the HSA HRA model. The district is contributing more to the health savings account this year. So that purple, you're going to notice the district is contributing $1,600 into basically a private bank account for you. Okay? You'll have a Care Fund debit card. You'll swipe that card for medical and medical and prescription services. Okay? If you don't use all that $1,600, that is your money. You can use it on whatever you'd like that's a medical eligible expense preferred so that you don't have to pay taxes. Should you exceed the $1,600, the health reimbursement account kicks in and your debit card no longer works for medical services. So it's really crucial that you're monitoring your balance so you know when you're getting close to that $1,600 because that's when things flip over. The debit card then is only used for prescriptions at the point of sale. Your medical costs automatically will be paid by MVP to the provider. Okay, so things flip over there. Should you get to $6,450, then MVP pays 100%. So you don't have to worry about paying anything. The district doesn't pay anything more at that point. The plan pays the rest of that in network. As far as the family side, or 2% to the right there, same idea, but the district is contributing more to the health savings account, $3,200 this year. If you use all of that or exceed, then it flips to the HRA model. Again, your debit card will only work for prescriptions at that point, and the bills will automatically be paid on the medical side by MVP. If you reach the out-of-pocket maximum, everything's covered in full at that point. Mentioned that we have the increased dollar figures. MVP is responsible for tracking all your medical and prescription charges towards your deductible, so you don't have to do that. It's always a good idea, though, to make sure you're keeping an eye out for your explanation of benefits. You're going to, again, use that care card in the beginning for both, when the HRA kicks on, just for prescriptions, and remembering that HSA funds belong to you if they're unused. If you're a person that chose the HRA only option, so you basically forfeited the HSA option because maybe you're not eligible for one, or you just prefer to have the HRA method, it works a little bit differently, but the dollar amounts are the same. So if you have a dependent, for instance, that you don't cover on your tax return, if you're on Medicare, Medicaid, or receive VA benefits, or if you're covered under another high deductible plan, those are just some instances where you would not typically want to do the HSA. You would probably elect this HRA only option. But definitely talk to your accountant if you're questioning your HSA eligibility or anyone that's on your medical plan's eligibility. So the HRA is funded with the full in-network deductible. It's not a rollover like the health savings account. Basically from $1, you're going to use your card just for prescription only, and the medical services are going to be paid directly by MVP to your providers. Okay, so there's no switch like there is in the last option we talked about. Okay? You'll notice the graph to the right, though, the dollar amounts are the same. It's still up to $6,450 or $12,900. Okay? How do providers get paid under the HRA? So just as you always would when you go for a medical visit, you're going to show your MVP ID card. They're going to submit the claims to MVP. They're going to figure out what that claim is, and then MVP is going to pay your provider. So we talked about just keeping an eye out on your explanation of benefits or your EOB. The provider bills sometimes are sent before they receive payment from MVP. So what do I do in that instance? We encourage everyone to create an account, a mymvphealthcare.com account, because this is how you're going to see what was posted. If maybe the provider really was paid and maybe this crossed in the mail. This is really going to be your way to keep track of that. But let's say you got a bill and it's been a couple of weeks and you have not seen the payment post on the MVP side. You've got two options. You can either email our customer care center, which we've got customer care cards down here. You can certainly grab one, and you can explain to them the situation and they can help you. Or you can go directly to the My Spending Accounts email address with MVP and do the same thing. Whatever you feel comfortable with, you can find out if your bill has been paid or maybe what the holdup would be. Providers really shouldn't be requiring payment at the time of service, but if they do, we can help you get reimbursed, or even better, if you let our customer care team know, we like to provide a letter on district letterhead explaining how your plan works and that they are going to get paid. Your plan is very unique, so providers just might not be used to this type of arrangement. So usually when we provide them a letter on district letterhead, they've been okay with that and they have not charged our folks up front. So just something, if you ever get into that situation, please let our office know. Health plan education. So this is Steve, and Steve has a sore throat. So Steve has a choice to make about his site of care. We talked about that as one thing that's driving claims. So if Steve goes to the ER, the average cost for an ER visit is $2,000. So if he has an HSA, he's really blowing through his whole HSA and he doesn't have any money to save. Urgent care is about $430. Physician office is about $107, and GIA costs nothing. Okay, so if Steve thinks he can talk to a doctor quick and get a quick prescription for nothing, he might decide to do that so he can save his HSA money. So when it comes to the Norwich claims data, when we took a look at what we call non-emergent ER visits, we had in the last year about 105 visits that were deemed non-emergent, which would be a headache, sinus infection, things of that nature. So about $210,000 of ER visits that might have been addressed just as easy in like a physician's office or with GIA, right? So that's what we mean by site of care. Now, of course, if there's a true emergency, we definitely want everyone to go to the emergency room. But if you have a sore throat like Steve, you might consider another option for your own benefit to save in your health savings, but also for the plan's benefit, because that's what determines our increases every year. Okay, and
So,
I'll turn it over to Wendy.
I'm going to tell you a little bit more about GIA. Obviously, that's an option for you at no cost. GIA by MVP is an app that you download to your mobile device. You would want to do that ahead of time so that it's ready to go when you do need it. You use GIA for urgent care with a phone call. So great option for cold, flu, pink eye, some minor injuries, even an urgent prescription refill can all be done using the app. You don't need to wait in doctor's offices, travel with a sick kid, even a great option for those who have college students away from home. Help get the app on their phone before they leave so they can receive care. The GIA app does show the wait time, and it is something that is available 24/7. So again, keeping us from needing to go find an emergency room when the regular doctor's office isn't open. You can also use the everyday primary and specialist healthcare using an in-app messaging. That's for the management of health concerns like diabetes, anxiety, high blood pressure for those that are ages 18 and up. They can transition to a video call when needed or set you up with an in-person visit. Behavioral health care is available with video appointments. There is no need for a referral. That can be for therapy and medication management. The behavioral health care is available for ages 12 and up. Psychiatry services for ages 18 and up. My Visit Now video calls can also be used for nutrition and lactation consultations. Besides easy access to medical care, basically in the palm of your hand, anytime and anywhere that you need it, GIA allows you to view your member ID card, find doctors near you, and estimate the cost of treatment. GIA informational items are also available on their website, but the virtual care options that I've told you about are only available on the GIA app. When your medical care isn't something that's urgent, the medical care estimator allows you to compare pricing from different providers to decide where best meets your needs. This could be an instance where using the website might be a little bit easier as you're hunting up providers in your area, but this is also available on the GIA app.
And I'll just give my example. So a lot of people don't realize, like an MRI, for instance, can cost a different amount based on where you go. So a local facility might charge $500 for that MRI of upper limb. A hospital might charge $5,000. Again, thinking if the HSA is my bank account, why wouldn't I pay $500 instead of going through the whole HSA? So that's what we mean by shopping for medical services. There's different costs for all services. And I'm up again. Preventive care. So through the pandemic, we found a lot of people slowed down their preventive care and screenings. We want to encourage people to get back up to date with their annual physicals. So every year getting that annual screening and making sure if you've hit certain milestones, you have caught up on your regular preventive screenings, whether it's pap smear, mammogram, colonoscopy, because that's going to be best for you and your health, of course, and it will keep your out-of-pocket costs down, right? So keeping early detection obviously is a good thing for everyone's health. So that's our challenge for everyone today that's listening. When it comes to prescriptions, we could talk about this all day, but just wanted to touch on it. If you are going to be prescribed something new, it's always a good idea to see if there's a generic available. It's going to be the best cost for you, and there's very effective generics. The brand drugs, you can tell because they've got those fancy commercials, the famous people, the jingles. That's how you know they're very, very expensive. They're also very expensive for you as a member. Something you could also consider is if you're on a maintenance medication, you can look into a 3-month supply. So when you're buying something in bulk, of course, it's going to cost you less. We wanted to put a couple of examples here just to bring to light the difference in cost for a few very common drugs we see with our school districts. Blood thinner, warfarin, very common, about $168 annually. Xarelto, which is a brand, is about $4,200 annually. Metformin is a generic for type 2 diabetes. If you were to take 2 500 milligram pills, the total cost is about $240 per year. Just taking one pill instead could be upwards of $30,000 per year. So forget about your health savings account, right, if you want to take one pill, but if you're like, I guess I could take 2 pills, boom, now you might have some health savings account money left over. So we encourage everyone just to talk with your doctor, even if you're on something right now, if there's an alternative that can save you money, that would be wonderful for you. Some other very common prescriptions, we're going to talk about rheumatic disease and anti-psoriasis. Methotrexate is really a great first step. It's a generic that's less than $1,000 per year. You can see Humira and Stelara, $65,000, just about $45,000. We've seen Stelara to be some milligrams to be about $200,000 per year. So again, checking out the generic, they're effective, they've worked for plenty of people, and if the generic doesn't work, stepping up is certainly reasonable, right? And then the last one is just eczema. We've got Dupixent, also has the very fancy commercial you can see is $34,000, whereas the generic is $288. So there's a million examples like this, so just advocate for yourself. Talk to your doctor and see if you can save yourself some money.
Oh, back to me.
Dental.
So the district still offers 3 plans, a low, a mid, and a high plan. There is an open enrollment email that is going out to everyone today went out to everyone today at 4:30. So when you log in to the new online open enrollment portal, you'll see the options that you have available. Of course, we recommend that you utilize an in-network provider to maximize the benefits of the dental plan. So we're just going to focus on those 3 in-network columns. Your preventative and diagnostic services, like twice-a-year cleanings and x-rays, are covered in full, regardless of which plan you choose. Basic restorative services, like fillings, are covered at 50% for the low plan, 80% for both the mid and high plan. Major restorative treatments, like crowns, are covered at 50% for the low, mid, and high plan. There is a $50 per person deductible each year that does not apply to preventative services. So if the only visits you're having that year are just for cleanings, you will not be charged that amount. The maximum coverage per person is $1,000 per year on both the low and mid plan and $1,500 on the high plan. As you can see here, the only plan that offers orthodontia coverage is the high plan. That does have a $2,000 lifetime limit. Anytime you're having treatments done beyond the preventative, you would want to ask your dentist to give you an estimate so that at the time of service when you come back, you'll know exactly how much that pricing will be. If you have upcoming dental services after July 1st, Christina's going to share some information in a few minutes about limited purpose FSAs. Those are to cover dental and vision charges. I do want to point out, the percentages shown in the out-of-network column look the same as in-network, but it is misleading. Out-of-network providers have not agreed to the pricing that Guardian has. So in this case, that percentage represents what Guardian will pay according to the fee schedule they have set as an average rate for your area, and not the actual cost that your dentist is going to charge. So you would be receiving a bill for the difference. To find your in-network dentist, you're going to visit guardiananytime.com. There's a link right there at the top of the page. So let's now run through vision. So still with Guardian, they offer the VSP Vision Plan. We refer to this as a 12-12-12 plan. It designates that your exam, your lenses and frames are available once every 12 months. Again, we're going to focus on the in-network column. Eye exams are $10 available once a year. Copay for materials is $25. That same applies to single, bifocal, trifocal, and lenticular lenses once a year. Your elective contact lenses, you have a $200 per year allowance, and you could be responsible for amounts beyond the $200. Medically necessary contact lenses, though, are a $25 material copay. The frame allowance in network is $200. If you choose a more expensive frame, you just pay the difference. Quite a few asterisks here in the out-of-network column that indicates that you would be paying for any amount over these dollar amounts shown, which is why choosing an in-network provider really does benefit you. Again, to find an in-network vision provider, guardiananytime.com.
Okay, and flexible spending account, as Wendy indicated, there is a limited purpose, but there's a couple other kinds. So just very briefly, a flexible spending account, just the generic one, would be if you are not on a high deductible plan, you could set some pre-tax money aside to pay for your expenses. You do that through the open enrollment process. Limited purpose is the flexible spending that goes with your high deductible plan. So if you know you or your family members have some big dental or vision expenses coming up, maybe you need a really expensive pair of glasses, you could set some pre-tax money aside in this limited purpose that would only be for dental and vision expenses. And then lastly, dependent care FSA, if you have a child in daycare, this doesn't matter what plan you're on, you can set aside money, and that would be to pay child care providers, but you'd get the tax break for that. Okay. The last thing we want to talk about is online open enrollment. So this year, your open enrollment will be online. So like Wendy said, everyone should have received an email. So it will come from noreply@employeenavigator.com, just so everyone knows that it's not spam. You're going to get to a page that looks similar to this, but it'll say your name. You're going to click that green start button to go through the process. You'll notice there's some other buttons here though, if you want to look at the document library, some of the other demographics, if you want to make sure your information is correct, you can explore here, you can't hurt anything. But if you're ready to start open enrollment, you click start. You're going to go through all the benefits. It won't let you go on to the next one without making your election. You can either make the election yes, or you can decline the benefit. It will ask you things like if you have other coverage, so just be prepared if you have another coverage to put information in there about your coordination of benefits. When you get to the end, you're going to see an enrollment summary. You must click sign to finalize your benefits. Okay, so it will have you check over every plan that you enrolled in. If you're good, you're going to do click to sign, hit that green button, and then you're going to get an email and it'll say something like, congratulations, you did it. And on anything in this presentation today, including online enrollment, if you ever have any questions, please feel free to reach out to our office. We've got a customer care center that's in office Monday through Friday, 7:30 to 5. Take a call center card or two, hand them out to your friends, and just when you call or email, just identify yourselves as a member from Norwich City School District. They'll pull up this presentation, they'll pull up your plan, and then they'll be able to help you with whatever questions you have. Happy open enrollment, everybody.